L-Nutra Health is the medical division of L-Nutra. We offer clinically designed programs that reverse metabolic conditions like type 2 diabetes and obesity by addressing the root causes and unlocking the body's ability to heal without the burdens of medications and their side effects.
It focuses on applying cutting-edge, evidence-based science behind merging nutrition as medicine and lifestyle medicine together to elevate the way we support patients in dealing with chronic conditions.
I was feeling sluggish, moody. I wanted to hike with friends. And I always felt bad because I was the one who was like behind, and they would reach the summit before I would. I always felt like I was holding them back. It was like, put you on medication and change your diet was what I was told to do. And nothing was working.
I tried to eat healthy, count calories, that type of thing, and it just didn't work for me.
When I looked into how I was going to get into diabetes remission, what intrigued me the most about the L-Nutra program was the fact that it had provided doctors, it provided the FMD package once a month, it included bi-weekly visits with a dietitian. I looked at the price versus what you got, and I thought it was quite a deal, with or without insurance. It provided a lot of support and motivation and accountability that I thought that I could use to increase the probability of success.
So you've got a dietary disease, and people treat it with drugs, and then they wonder why the diabetes isn't getting better. Well, you never treated the root cause. So this is why I think the FMD is really such an important advance, because now what we're doing is we're taking the treatment paradigm of a very structured program, sort of like medications, right? Here, take one every day, take one twice a day, whatever it is, right? You take that same sort of structure with no ambiguity, and then you're giving it to patients saying, do this, right? There's no ambiguity. There's none of this, oh, should I eat this? Should I eat this? Is this good for me? Is this good for me? No, it's like, this is what you take for those 5 days of your FMD. So it's sort of almost merging the two things, trying to take the dietary part of things and merge it with the way that medicine is practiced these days, giving a very structured program to people that they can follow without any sort of questions asked.
You're not relying only on a product, but you also have supportive services coming from registered dietitians that meets with you twice a month. You'll have physicians that oversees the process, so it's safe. There are laboratory markers that physicians track over time to ensure a safe journey. There are digital health tools like Smart Scale, like an app that makes the journey much easier. Together, these elements help to support you onto a safe journey to either to weight loss, to medical weight loss, or to a journey of type 2 diabetes remission.
After I started the L-Nutra Health program, my A1C dropped considerably. I felt lighter, I felt less bloating, I felt stronger.
I didn't think that you could notice that the weight was gone, but I didn't have to unbutton my pants during the day. I could just tell that my clothes were fitting much, much better. The second box progressed, I lost another 4 or 5 pounds, and in between that first box and that second box, I lost another 4 or 5 pounds on my own.
My daughters mean the world to me. I was proud of the fact that I was able to not only follow through, but that they got to see it firsthand. I didn't expect that it would be as easy as it was, even though it is hard to get there. It's easy to prepare the meals and continue on working without any disruption in my daily life.
After 3 months of being on the program, my A1C went from 6.6 to 6.1. I lost 20 pounds in those first 3 months, and I was blown away.
I went from an average of 900 steps a day up to 6,000 steps a day. I'm on the floor playing with my grandkids. I got involved in a women's group, and I now cook the meals for when they have gatherings. I couldn't have done any of that without the program.
My biggest recommendation is just do it. You won't understand until you do it, and then you won't feel it until you do it.
What have you got to lose? Give it a try, and you will just feel the difference within your body. So I say try it. You've got nothing to lose.